Hi, I'm Dr. Chris Hollowell from Urology. People often associate Botox with its cosmetic uses like for wrinkles. However, Botox is actually FDA indicated for 9 different disease processes. Surprisingly, its original use was for cross-eyed in 1978. Bladder Botox was FDA approved in 2011 for overactive bladder. Its symptoms include nocturia, frequency, and urinary urge incontinence. It is highly effective in treating these symptoms. Botox is often used as a second-line therapy to oral medications for overactive bladder. However, oral medications generally only have about a 20% success rate versus Botox, which has over an 80% success rate for treating these symptoms. Thus, it has a far superior effect. First, it is important to understand that there are 2 types of leakages of urine: stress urinary incontinence and urge urinary incontinence. Most believe that Botox will fix everything. It will only treat the overactive bladder symptoms and the urinary urge incontinence. It will do nothing for the stress incontinence. This requires a small surgical procedure done in the hospital called a mid-urethral sling. There are a few realistic side effects of bladder Botox to be considered. Urinary tract infection and urinary retention are the 2 most common side effects, and these only happen rarely. The main downside to Botox is it only lasts 6 months, so patients will have to come into the office to have it re-injected twice a year. The procedure is done via cystoscopy, which only takes a couple minutes under local anesthesia. There is no recovery from the procedure done in the office. You may drive yourself home afterwards. People often believe that it will take effect magically and work right away, but it will take approximately 2 weeks to begin to see the improvements. And like clockwork, the effects will wear off in 6 months. It is generally covered by most insurances, and it is a simple, safe, and effective treatment for overactive bladder syndrome and urge urinary incontinence. Aren't you sick and tired of getting up at night to urinate and frequently going to the bathroom during the day, interrupting your daily activities? Why wait? Make an appointment today at Urology and take back control of your active lifestyle. Dr. Christopher Hollowell, Urology, Fort Lauderdale, Florida.